What is bipolar disorder? Bipolar disorder, previously known as manic depressive illness, is a mental illness that causes unusual shifts in mood, energy, activity levels, concentration, and the ability to carry out day-to-day tasks. There are 3 types of bipolar disorder. All 3 types involve clear changes in mood, energy, and activity levels. These moods range from periods of extremely up, elated, irritable, or energized behavior, known as manic episodes, to very down, sad, indifferent, or hopeless periods known as depressive episodes. Less severe manic periods are known as hypomanic episodes. Number 1. Bipolar 1 disorder is defined by manic episodes that last at least 7 days or by manic symptoms that are so severe that the person needs immediate hospital care. Usually, depressive episodes occur as well, typically lasting at least 2 weeks. Episodes of depression with mixed features are also possible. The experience of 4 or more episodes of mania or depression within a year is termed rapid cycling. Number 2. Bipolar 2 disorder is defined by a pattern of depressive episodes and hypomanic episodes, but the episodes are less severe than the manic episodes in bipolar 1 disorder. Number 3. Cyclothymic disorder, also called cyclothymia, is defined by recurrent hypomanic and depressive symptoms that are not intense enough or do not last long enough to qualify as hypomanic or depressive episodes. Sometimes a person might experience symptoms of bipolar disorder that do not match the 3 categories listed above, and this is referred to as other specified and unspecified bipolar and related disorders. Bipolar disorder is typically diagnosed during late adolescence or early adulthood. Occasionally, bipolar symptoms can appear in children. Although the symptoms may vary over time, bipolar disorder usually requires lifelong treatment. Following a prescribed treatment plan can help people manage their symptoms and improve their quality of life. What are the signs and symptoms of bipolar disorder? People with bipolar disorder experience periods of unusually intense emotion, changes in sleep patterns and activity levels, and uncharacteristic behaviors, often without recognizing their likely harmful or undesirable effects. These distinct periods are called mood episodes. Mood episodes are very different from the moods and behaviors that are typical for the person. During an episode, the symptoms last every day for most of the day. Episodes may also last for longer periods, such as several days or weeks. Symptoms of a manic episode. 1. Feeling very up, high, elated, or extremely irritable or touchy. 2. Feeling jumpy or wired, more active than usual. 3. Decreased need for sleep. 4. Talking fast about a lot of different things, also called flight of ideas. 5. Racing thoughts. 6. Feeling able to do many things at once without getting tired. 7. Excessive appetite for food, drinking, sex, or other pleasurable activities. 8. Feeling unusually important, talented, or powerful. Symptoms of a depressive episode. 1. Feeling very down or sad, or anxious. 2. Feeling slowed down or restless. 3. Trouble falling asleep, waking up too early, or sleeping too much. 4. Talking very slowly, feeling unable to find anything to say, or forgetting a lot. 5. Trouble concentrating or making decisions. 6. Feeling unable to do even simple things. 7. Lack of interest in almost all activities. 8. Feeling hopeless or worthless, or thinking about death or suicide. Sometimes people experience both manic and depressive symptoms in the same episode, and this is called an episode with mixed features. People experiencing an episode with mixed features may feel very sad, empty, or hopeless while at the same time feeling extremely energized. A person may have bipolar disorder even if their symptoms are less extreme. For example, some people with bipolar II disorder experience hypomania, a less severe form of mania. During a hypomanic episode, a person may feel very good, be able to get things done, and keep up with day-to-day life. The person may not feel that anything is wrong, but family and friends may recognize the changes in mood or activity levels as possible bipolar disorder. Without proper treatment, people with hypomania can develop severe mania or depression. Diagnosis on bipolar disorder. Proper diagnosis and treatment can help people with bipolar disorder lead healthy and active lives. Talking with a doctor or other licensed healthcare provider is the first step. The healthcare provider can complete a physical exam and order necessary medical tests to rule out other conditions. The healthcare provider may then conduct a mental health evaluation or provide a referral to a trained mental health care provider, such as a psychiatrist, psychologist, or clinical social worker who has experience in diagnosing and treating bipolar disorder. Mental health care providers usually diagnose bipolar disorder based on a person's symptoms, lifetime history, experiences, and, in some cases, family history. Accurate diagnosis in youth is particularly important. Bipolar disorder and other conditions. Many people with bipolar disorder also have other mental disorders or conditions such as anxiety disorders, attention deficit hyperactivity disorder, misuse of drugs or alcohol, or eating disorders. Sometimes people who have severe manic or depressive episodes also have symptoms of psychosis, such as hallucinations or delusions. The psychotic symptoms tend to match the person's extreme mood. For example, someone having psychotic symptoms during a depressive episode may falsely believe they are financially ruined, while someone having psychotic symptoms during a manic episode may falsely believe they are famous or have special powers. Looking at symptoms over the course of the illness and the person's family history can help determine whether a person has bipolar disorder along with another disorder. Treatments and therapies for bipolar disorder. Treatment can help many people, including those with the most severe forms of bipolar disorder. An effective treatment plan usually includes a combination of medication and psychotherapy, also called talk therapy. Bipolar disorder is a lifelong illness. Episodes of mania and depression typically come back over time. Between episodes, many people with bipolar disorder are free of mood changes, but some people may have lingering symptoms. Long-term, continuous treatment can help people manage these symptoms. Medications for bipolar disorder. Certain medications can help manage symptoms of bipolar disorder. Some people may need to try several different medications and work with their healthcare provider before finding medications that work best. The most common types of medications that doctors prescribe include mood stabilizers and atypical antipsychotics. Mood stabilizers such as lithium or valproate can help prevent mood episodes or reduce their severity. Lithium also can decrease the risk of suicide. Medications that target sleep or anxiety are sometimes added to mood stabilizers as part of a treatment plan. While bipolar depression is often treated with antidepressant medication, a mood stabilizer must be taken as well, as an antidepressant alone can trigger a manic episode or rapid cycling in a person with bipolar disorder. Because people with bipolar disorder are more likely to seek help when they are depressed than when they are experiencing mania or hypomania, taking a careful medical history is essential to ensure that bipolar disorder is not mistaken for depression. People taking medication for bipolar disorder should strictly consider the following. 1. Talk with their healthcare provider to understand the risks and benefits of the medication. 2. Tell their healthcare provider about any prescription drugs, over-the-counter medications, or supplements they are already taking. 3. Report any concerns about side effects to a healthcare provider right away. The healthcare provider may need to change the dose or try a different medication. 4. Remember that medication for bipolar disorder must be taken consistently, as prescribed, even when one is feeling well. 5. Avoid stopping a medication without talking to a healthcare provider first. Suddenly stopping a medication may lead to a rebound or worsening of bipolar disorder symptoms. Psychotherapy. Psychotherapy, also called talk therapy, can be an effective part of the treatment plan for people with bipolar disorder. Psychotherapy is a term for a variety of treatment techniques that aim to help a person identify and change troubling emotions, thoughts, and behaviors. It can provide support, education, and guidance to people with bipolar disorder and their families. Cognitive behavioral therapy, CBT, is an important treatment for depression, and CBT adapted for the treatment of insomnia can be especially helpful as a component of the treatment of bipolar depression. Treatment may also include newer therapies designed specifically for the treatment of bipolar disorder, including interpersonal and social rhythm therapy, IPSRT, and family-focused therapy. Determining whether intensive psychotherapeutic intervention at the earliest stages of bipolar disorder can prevent or limit its full-blown onset is an important area of ongoing research. Other treatment options. Some people may find other treatments helpful in managing their bipolar symptoms, including electroconvulsive therapy, ECT, is a brain stimulation procedure that can help relieve severe symptoms of bipolar disorder. ECT is usually only considered if an individual's illness has not improved after other treatments such as medication or psychotherapy, or in cases that require rapid response, such as with suicide risk or catatonia or a state of unresponsiveness. Light therapy. Light therapy is the best evidence-based treatment for seasonal affective disorder, and many people with bipolar disorder experience seasonal worsening of depression in the winter. Light therapy could also be considered for lesser forms of seasonal worsening of bipolar depression. Unlike specific psychotherapy and medication treatments that are scientifically proven to improve bipolar disorder symptoms, complementary health approaches for bipolar disorder, such as natural products, are not based on current knowledge or evidence. Finding treatment. A family health care provider or doctor is a good resource and can be the first stop in searching for help. Coping with bipolar disorder. Living with bipolar disorder can be challenging, but there are ways to help make it easier for yourself, a friend, or a loved one. Here are some tips to cope with bipolar disorder. 1. Get treatment and stick with it. Treatment is the best way to start feeling better. 2. Keep medical and therapy appointments and talk with your healthcare provider about treatment options. 3. Take medication as directed. 4. Structure activities. Keep a routine for eating, sleeping, and exercising. 5. Try regular, vigorous exercise like jogging, swimming, or bicycling, which can help with depression and anxiety, promote better sleep, and is healthy for your heart and brain. 6. Keep a life chart to help recognize your mood swings. 7. Ask for help when trying to stick with your treatment. 8. Be patient. Improvement takes time. Remember, bipolar disorder is a lifelong illness, but long-term, ongoing treatment can help control symptoms and enable you to live a healthy life.
This will end today's video. Thanks for watching. Please check out our channel for more videos like this.